Sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com. What is axial spondyloarthritis? Axial spondyloarthritis, axSpA, is a form of inflammatory arthritis that causes chronic pain in the lower back and axial joints, spine, chest, and pelvis. This progressive condition can cause severe pain along with stiffness and fatigue. Getting an early diagnosis and beginning treatment is key to managing axSpA. /r/n/r/n This article discusses the symptoms, causes, diagnosis, and treatment for axSpA. /r/n/r/nPeople Images, Getty Imagesrnrn The two types of axial spondyloarthritis are /r/n/r/n Nearly 1.5 million Americans are affected by axSpA. The average onset of symptoms is typically at age 28, and most people are diagnosed before the age of 45. /r/n/r/n Axial spondyloarthritis symptoms are caused by autoimmune responses in the body that cause inflammation in the spine and joints. /r/n/r/n As the condition progresses, symptoms may come and go and may vary in intensity. Symptoms typically worsen after periods of inactivity, such as sleeping and resting. /r/n/r/n Back pain is the first and most predominant symptom of axSpA. If your back pain is related to axial spondyloarthritis, it may be /r/n/r/n Aside from back pain, other common symptoms of axSpA include /r/n/r/n Men and women with axSpA may experience different symptoms. Women tend to have more peripheral pain in the neck, shoulders, hips, and other joints than men. /r/n/r/n Researchers are continuing to explore the causes of axial spondyloarthritis. Though a specific cause has not yet been identified, there are certain risk factors that can increase your chances of developing axSpA. /r/n/r/n These risk factors include /r/n/r/n If you suspect you have axial spondyloarthritis, schedule a visit with your healthcare provider or a rheumatologist, a doctor who specializes in joint-related conditions. Early diagnosis can ensure you receive timely and effective treatment and improve your long-term outcomes. /r/n/r/n To reach a diagnosis of axial spondyloarthritis, your healthcare provider will begin with a review of your medical history, risk factors, such as family history and other autoimmune conditions, and ask about the symptoms you are experiencing. They will do a physical examination to look for joint inflammation in your spine, pelvis, and hips. /r/n/r/n Your healthcare provider may also assess your mobility and flexibility by asking you to move your body in certain ways. These movements may include reaching for your toes, lifting up your leg, and putting your chin to your chest. /r/n/r/n They may also perform a neurological evaluation to assess your motor and sensory functions, such as your muscle strength and reflexes. /r/n/r/n Lab work and imaging tests are important steps in giving an accurate diagnosis of axSpA. Blood tests will look for /r/n/r/n Blood tests alone cannot provide enough evidence to diagnose axial spondyloarthritis, so you may also undergo some imaging tests. These tests will look for evidence that axSpA has affected your spine and joints. Tests can include /r/n/r/n Nearly half of all people diagnosed with axSpA wait 5 or more years for a diagnosis, which can lead to irreversible spine damage. /r/n/r/n There is no cure for axial spondyloarthritis, but treatments can help manage symptoms and slow the progression of the disease. /r/n/r/n Depending on the severity of your symptoms, your healthcare provider may recommend certain types of medication, including /r/n/r/n Another way to help relieve axSpA symptoms is with exercise. /r/n/r/n When you're in pain, exercising may be the last thing you want to do. However, most people with axSpA find relief from their back pain with movement and gentle stretching. Finding an exercise program and sticking to it can help you build muscle and maintain a healthy weight, which protects the joints from extra pressure and stress. /r/n/r/n Flexibility exercises and stretching can help preserve your mobility and joint function. /r/n/r/n If axSpA has caused significant damage to your spine that limits your mobility or causes debilitating pain, your healthcare provider may recommend surgery. The affected joints will be replaced with a prosthetic to restore function and mobility and provide pain relief. /r/n/r/n Living with axial spondyloarthritis means experiencing a variety of symptoms that can have a tremendous impact on your life. Living with chronic pain is hard, and finding ways to cope can go a long way in helping you live life to the fullest. /r/n/r/n Though your pain may not fully disappear, there are measures you can take to alleviate the pain and find ways to cope, including /r/n/r/n Axial spondyloarthritis is a condition affecting the spine, chest, and pelvic joints. It can lead to severe back pain as well as other symptoms. Diagnosis is often delayed, so it's important to meet with your healthcare provider if you are experiencing pain and other related symptoms. Treatment options such as medication, surgery, and lifestyle changes can help. /r/n/r/n Living with axial spondyloarthritis can impact every aspect of your life, from your work life to your family life, your sleep, and your emotional and physical well-being. With an accurate diagnosis and proper treatment, it is possible to live a full, happy life with axSpA. Following your treatment plan and making healthy lifestyle choices can help reduce your pain and slow the progression of the disease. /r/n/r/n rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.